Mummification is a strict thermodynamic process. It is defined by rapid dehydration, where tissue desiccation outpaces bacterial decay by rapidly expelling its moisture. Standard putrefaction relies entirely on a water-rich environment. Without moisture, the microorganisms responsible for biological breakdown simply cannot multiply. When ambient evaporation strips the cellular water content from a cadaver faster than those bacteria can colonize, the decay cycle comes to a permanent halt. This chart plots the mechanics of that biological race. You can see two competing trajectories over time, an evaporation rate climbing sharply, while bacterial growth remains entirely flat. Crossing that thermodynamic threshold permanently locks the remaining cellular structure into its exact physical configuration. By arresting the decomposition cycle, the environment yields a highly stable, albeit heavily distorted, physical record of the cadaver. Mummification in forensics is never intentional preservation. It is a thermodynamic accident that freezes time, delivering intact physical evidence directly to the medico-legal investigator. Public perception of this state is heavily skewed by intentional chemical embalming, like the wrapped remains found in ancient Egyptian sarcophagi. In modern forensic pathology, human intervention is completely absent. The condition is entirely driven by environmental exposure. The gross morphological outcome is stark. The skin converts into a leathery, rusty brown shell, pulled tightly over the underlying skeletal frame. While this extreme preservation allows for accurate personal identification months or years after death, it introduces highly specific diagnostic complications on the autopsy table. A forensic pathologist evaluates the mummified cadaver strictly as a dynamic environmental artifact, one that actively distorts the physical signs of trauma. The sequence of desiccation maps perfectly onto the body's surface area. Mummification initiates at exposed regions, the lips, tip of the nose, and ears. From there, moisture loss travels distally, rapidly desiccating the hands and feet. Eventually, the process moves centrally, consuming the entire dermal layer of the trunk. As liquefied subcutaneous fat is absorbed into the shrinking tissue, the skin takes on a distinct translucent quality. The structural collapse is not limited to the surface. Deep internal organs suffer massive, simultaneous water loss. The individual organs shrink, harden, and ultimately fuse together into a single, dark, unidentifiable mass inside the chest cavity. Yet, under a microscope, this mass retains its biological identity. Fine elements like collagen, cartilage, and skeletal muscle remain perfectly demonstrable to a histologist. The body functions as a contracting biological sponge, collapsing its internal architecture completely while rigidly preserving its external topography. This degree of extreme desiccation requires between 3 to 12 months to complete, dictated entirely by external variables. The process demands a strict environmental triad: extreme high temperatures, low humidity, and continuous free air. High humidity will immediately restart putrefaction. For mummification to succeed, the macroenvironment must remain aggressively arid. The microenvironment of the burial substrate plays an equally critical role. A body left in a shallow grave will lose moisture at an accelerated rate. Dry, sandy soil acts as a physical desiccant, aggressively wicking fluids out of biological tissue. But environmental heat is not the only trigger. Systemic chemical catalysts can artificially induce the exact same physiological desiccation. Heavy metal accumulation in antemortem tissue radically alters the postmortem bacterial flora, retarding the growth of decomposing microorganisms. Chronic exposure to arsenic prior to death acts as a primary chemical driver, aggressively accelerating the mummification process regardless of the ambient climate. Antimony presents the exact same toxicological profile, perfectly mimicking the preservative effects of an arid desert environment. The mummified state provides a definitive physical record of exposure to extreme dry heat and absorbent soil, or a systemic history of heavy metal poisoning. Pathologists occasionally encounter a highly specific edge case, a single cadaver undergoing aggressive desiccation and humidification simultaneously. Adipocere or grave wax is a distinct postmortem change caused by the hydrolysis of fat in localized moisture-rich environments. This diagram shows how adipocere can form on the exact same body that is otherwise completely mummified. Heavy subcutaneous fat deposits in the cheeks, buttocks, and abdomen trap their own local moisture. This permits saponification internally, even while the external environment is completely dry. The human body functions as an ecosystem of microclimates. Postmortem changes are regional, governed by localized fat and trapped moisture, not just overarching weather patterns. The primary investigative benefit of mummification is the relative conservation of facial features and existing antemortem injuries. However, the mechanical physics of drying skin present a fatal diagnostic trap. As the dermal layer shrinks and loses its water content, it generates massive physical tension across the underlying skeletal structure. The highest structural friction points are the anatomical prominences, the cheekbones and the chin, the costal margins and the hips. This unrelenting stretching creates so much kinetic tension that the skin inevitably tears itself open to release the pressure. These post-mortem fissures commonly manifest in soft tissue junctions, like the groin, the neck, and the armpits. To an untrained eye, these jagged splits look virtually identical to antemortem sharp force trauma or deep incised stab wounds. The very mechanism that preserves the body's identity actively manufactures false physical evidence of foul play. The forensic pathologist's highest mandate is successfully differentiating these mechanical desiccation artifacts from true homicidal injuries. When decoded correctly, the remains provide an estimated time since death and confirm the precise conditions of the disposal environment. It also stands as a glaring red flag for toxicologists to test the remaining tissue for heavy metal poisoning. A mummified cadaver exists as a complex physical record. To uncover the true narrative of death, the investigator must decode the mechanical physics of the skin and distinguish environmental artifacts from trauma.